everyone, it's Dr. Amanda and Dr. Jeric here at Peak Performance, and today we want to talk about a common injury we see in golfers in our office, which is golfer's elbow. So this condition causes pain on the inside of the elbow where the tendons of the forearm muscles attach. This is typically kind of that pinpoint pain on that bone that can kind of spread into the forearm and down into the wrist. This is an overuse injury or repetitive use injury that's caused by muscle imbalances in the forearm, mobility limitations in the wrist or shoulder, improper form, or not using the right equipment that's for you.
So there's lots of ways that we can treat this in our office, but one of the ways we take a few steps towards it is looking to release the muscles around that area that are overworked. So we look at muscles in the extensor part of the forearm as well, or I'm sorry, the flexors, if I get my anatomy right, as well as extensors. We look towards tendons and ligaments that are overused and overworked, and we want to encourage what's called tendon remodeling with that. And also, we of course give rehab exercises so that you can get to the point to where you don't need us and you can enjoy your hobbies such as golf. So we do things such as dry needling, deep tissue laser. We do some instrument assisted work where we're scraping over the area. We do active release technique, of course, which is a big one for us. And then, of course, the exercises to get people on their way towards improving.
And adjustments in any of those regions where you may be restricted or stuck as well.
Of course. Yep. So in our next video that's going to be coming up, we're going to give you one example of one of the therapies that we use in the office called dry needling. So we'll do a quick little video about that to where you can see what dry needling looks like when we're applying that to muscles of the forearm to help with elbow pain. So stay tuned for that one next coming up, and we will see you next time. All right, so I get to play patient today. Dr. Amanda is going to do some dry needling to my elbow as if we were treating golfer's elbow. And like we mentioned in other videos, golfer's elbow is when people are having that pinpoint pain.
On the bone. On
the bone, on the inside of the elbow here, as you can see where Dr. Amanda's starting to kind of feel around for the needle placement. When she goes to put needles in this area, she's looking to encourage more tendon remodeling, which basically that means we're getting more blood flow to the tendon by inserting the needle into that area. So acupuncture needles are used in this, so you know there's different techniques to dry needling, but usually when it's being done, people will typically kind of feel a little bit of a twitch when the needle gets in there, but you really don't feel much through it. They're pretty small needles being used. Like with that one, I felt a little bit of a twinge as she got it into placement, and that's what you want, because when it hits that, it's basically getting a little bit of a muscle spindle to activate and give us that twitch, and that's when we know that remodeling is starting to take place in that area. So as she works down through the arm here, and she's got a couple in the elbow already, now she's going to start kind of feeling into the muscle tissue where there's more trigger points or locked up areas. Yep, that was a pretty good twitch there. Where we're not getting enough blood flow to that tissue because there has been damage in there. And again, whenever we're trying to get tissue to heal, we need blood flow there, because blood flow is what brings white blood cells that help us heal. I also bring nutrients and oxygen and hydration to the tissue to help that tissue heal and repair. So typically, dry needling only takes a few minutes once the needles are in place. And in some situations, she'll hook up basically a smaller E-stem model to it to get kind of an electric current going to the tissue and get those muscles to start twitching and responding. Every patient's needs are different, and so that's one thing when you're working with a healthcare professional. And dry needling really does need to be done with a trained healthcare professional. This is not something you can just go get some acupuncture needles and try at home. You shouldn't try acupuncture at home either. But this is a very effective treatment. There's lots of different techniques, and so finding a healthcare professional that works for you is always crucial. And because you just don't want anybody to be out there kind of sticking needles into your arm. So Amanda has all the needles in place here, and basically just a few minutes of letting them sit and do their job of encouraging tissue remodeling and tissue healing. and then she'll go through, take them out, and dispose of them as properly. But yeah, a highly effective technique that we use with other therapies in the office. If you're interested, if dry needling can help you with whatever you have going on, feel free to reach out to us, 785-842-7325. Again, just another great therapy we offer here at Peak Performance, and we'd love to help.